Thank you, everybody, for joining us. My name is John Neuer with HealthfirstPA. And before we begin, I just want to let folks know how they can ask questions. So you are able to ask questions with the Q&A dialog box that you should see in the bottom of your Zoom dashboard. You can type those questions in at any point in time. When we get to the end of the presentations, we'll open up the floor and we will read those questions out, and our presenters will answer those. We want to just let you know we're also recording the webinar. We'll be able to send you a link of the recording afterwards. Without further ado, I want to turn the floor over to Nina Victoria from Center for Coalfield Justice. She is a community advocate there, and she will also then introduce all of our speakers today. Nina?
Hi, everyone. Thank you so much for joining us at Health First PA's webinar on pollution and children's health. Today, we're going to be talking to impacted residents in East Palestine and talk about other issues affecting the health of Pennsylvanians. As John said, I am Nina Victoria, and I will be your MC this morning. I am a community advocate for the Center for Coalfield Justice, which is a frontline organization that aims to educate, protect, and empower residents in Washington and Greene counties dealing with issues related to coal mining, natural gas, and petrochemical infrastructure. As John said, we have a lot of good content to get through, so while you can ask your questions in the chat at any time, we will be having the Q&A session after all of the speakers have had a chance to give their presentation. So now let's get to the content. Up first, I will turn it over to Vanessa Lynch from Moms Clean Air Force to talk about their work in East Palestine. Vanessa is the field coordinator for Western Pennsylvania for Moms Clean Air Force. She lives with her husband and 2 children in Pittsburgh, where she has been actively advocating for children's rights in education and environmental health. Pennsylvania has a long history of industrial activity and mineral extraction that has taken a toll on communities, and Vanessa has witnessed this firsthand as the oil and gas industry has brought fracking to her residential community. Since then, Vanessa has worked hard to protect children's health at the local, state, and federal levels. Her work has been featured in PBS EcoSense, For Living, Yes Magazine, the Pittsburgh Post-Gazette, and on CBS Pittsburgh.
Okay. Hi, everybody. So I'll be talking today about petrochemical pollution and our health. As Nina said, I work with an organization called Moms Clean Air Force. Moms Clean Air Force is a community of over 1.5 million moms and dads across the U.S. and over 100,000 in Pennsylvania, united against air pollution and our changing climate to equitably protect children's health. And that's really the core of what we work on and the things that are really important to us. I wanted to just give a little background information, sort of reminding ourselves of what went on in East Palestine before we have a conversation with a local impacted resident. On February 3rd, 2023, was the day that the train derailment occurred, and you can see here a picture of the track of where the train had gone and where the train derailment occurred in East Palestine. For a closer view of why this conversation is so important in Pennsylvania, this is a map of DEP work where they went and did soil and water testing, but you can see where that little fire symbol is and that red line. The red line is the border in between Ohio and Pennsylvania. So this train derailment was very, very close to Pennsylvanians. This is a picture of the night of the train derailment. I think it's an important reminder that not only did the train derail, but there were huge fires that occurred as a result of that derailment. And really, that is an important part of the conversation because of the things that the train was carrying. We know now that 11 of the cars on that train that derailed were carrying hazardous chemicals, and that 5 were deemed unstable and volatile because of the vinyl chloride that they had inside of them. We also know that a lot occurred in between when the derailment happened and when Norfolk Southern decided to do their controlled burn that definitely were concerning to officials in Pennsylvania, who eventually sent a letter to Norfolk Southern about how things had occurred. The vinyl chloride was highly toxic for human health. It's a colorless gas, and it's been linked to cancers and can be very deadly. And what we know is that when vinyl chloride is burned, it can also create dioxins, which are another cancer-causing agent. And this is just a video of what that train derailment and then the subsequent, really this is the controlled burn, just to remind us of what that looked like. You can see that they were trying to burn off the chemicals, but one of the things that we know about black smoke is that that indicates that there were chemicals that weren't fully burned in the process. So what kinds of public health impacts were a result of this disaster? Well, the things that have been reported are things like difficulty breathing, burning throat and eyes, headaches, skin rashes, and vomiting. And those health concerns have mounted as time has passed. Toxicology experts know that children are particularly vulnerable because they typically breathe faster and have smaller lungs. And so the amount of toxins that they experience is increased from adults. And what we also know is that anyone who is in a more vulnerable category, such as being older or having other health concerns, can have also more significant impacts. I'll end with this video about a trip that moms took with some East Palestine moms to a Senate hearing in March.
A group of Ohio moms is on Capitol Hill right now calling on Congress to hold railway companies responsible for polluting the neighborhoods where their kids play.
The anxiety is real. We want to make sure that we are doing the best thing for our children and for our families, but only if it's safe. And there's still so much data that needs to come out to really guarantee that we are going to be safe in the long term.
I am worried about the future. You know, I am worried about health concerns. We have children, they're growing, they need healthy air, clean water. I feel like in America, we do have a right to those things.
She's a mom of 2 young children. She lives just over a mile from the site of the train derailment in East Palestine. Misty, thanks for joining us. Why was it important for you to come to D.C. today to watch this Senate hearing in person?
I think it's important to have a visual representation of the people of East Palestine and the surrounding area. This is not just a political issue, this is a people issue, and I'm here to represent not only moms like me, but other people in the area that have been impacted.
Misty, you'll be inside that hearing today. Alan Shaw, the CEO of Norfolk Southern, will be taking questions from the Senate. What do you want to hear from him today?
While it's nice to get an apology and that he's sorry for what happened, we need to make sure that there's some action with that. Sorry just isn't good enough.
We're here in the hallways waiting on this hearing to start so that we can tell our senators to stop putting chemical facilities in communities, killing people.
Okay.
Thank you, Vanessa. Now we will hear testimony from Hilary Flint, moderated by Rachel Meyer, on the impacts felt on the front lines of the East Palestine disaster. Hilary is a cancer survivor, chronic illness advocate, and environmental activist. She's the fourth generation to live in her home in the town of Enon Valley, Pennsylvania, which is less than 5 miles from the train derailment in East Palestine, Ohio. Hilary is also a founding member and vice president of Unity Council for the EP train derailment. Rachel is the Ohio River Valley field organizer for Moms Clean Air Force. She is particularly concerned with the threat of the petrochemical buildout as companies use the region's natural gas for the manufacturing of goods such as plastics. As an educator with a master's in environmental education and a mom, Rachel cares greatly about the health of our children and is dedicated to work that repairs our relationship with the natural world so that they may have a better future. That cares greatly about the health of our children and is dedicated to work that repairs our relationship with the natural world so that they may have a better future. Sorry about that, Rachel. Take it away, guys.
Okay, thank you, Nina.
Yes, thank you. And thank you for having me today. And of course, I always appreciate all the wonderful work that Moms has been doing for this cause and, for all of us.
All right, Hilary, can you tell us more about your journey as a young cancer survivor?
Yeah, so I always joke that I've been sickly since I was born. I've had a lot of pre-existing health conditions and diagnosed with rheumatoid arthritis, fibromyalgia, Raynaud's, Sjögren's, endometriosis, IBS, anemia, POTS. And it took me a long time to get, my health under control. It was about when I was in my mid-20s where I started to finally feel like I was really living life. And a few years after that, I just started getting really tired and I started having really bad back pain. And so after pretty much 2 years of being sick, it ended up that I had renal cell carcinoma, which is a form of kidney cancer. And because of all my pre-existing conditions, it was very difficult to find it. It took an ER visit. And later, I found out that my renal cell carcinoma was due to a CHEK2 gene mutation, which causes cancerous and non-cancerous tumors. And while these mutations have been in people's lineage for, obviously generations to come, what's happening now is that we're seeing these mutations affect people younger and younger. And they believe that's because environmental pollutants.
Mm-hmm. So dealing with cancer and these other chronic illnesses at such a young age had to be very difficult. What were some of the impacts of these experiences for you?
Well, I'll tell you, I didn't expect to be in my 30s and living in my childhood home. So due to my cancer diagnosis, I had to take some time off of work. And even with short-term disability, you're getting 60% of your pay when you have 100% of your bills, in addition to higher healthcare costs than you've ever experienced. So I decided to move back into my childhood home with my grandmother. My great-grandmother built this house. We're on the land that my family's been on for, 4 generations. And I thought living in the country was actually going to be a safe place for me to recover, both financially, emotionally, spiritually. And I thought it was going to be the best choice for my health and safety.
Well, and then we know what happened in East Palestine. Can you tell me about what you experienced when the train derailed and what impacts that caused for you?
Yes, so Enon Valley is a part of Darlington Township, which means I am less than 5 miles from where the train derailed. And that night, I started hearing sirens. And when you live in a small town that's not, you might hear some sirens, but not to this extent. So I knew something was wrong. I remember turning on the news, didn't see anything. So I turned to Facebook, and that's when I saw what happened. My heart was breaking for the people in East Palestine. I have a lot of friends there, but I didn't know it was going to impact me yet. And so it wasn't until the day of that open burn that I realized it was going to impact me. So we weren't officially evacuated. My family, our school district was, Blackhawk School District. Our house is actually much closer to East Palestine than the school district. So, given that knowledge, we decided to evacuate ourselves, and we paid, out of pocket for a hotel room that night. But then we were told that it was safe to come home, so we did.
And what were some of the health impacts you then started to have?
So I remember opening the door that day after we came home, and I was just hit with this smell of, was almost like I describe it as sweet bleach, which at the time I thought made no sense. And now, a lot of scientists are telling me, yeah, that makes total sense. So it was just like this assault of a smell. And I wasn't sure, is this going to be something that affected me? Well, almost immediately, I had a migraine, and then it transitioned to dizziness. And I still to this day have fatigue. And then I started getting itchy eyes and rashes, just really, really serious rashes, particularly after I would shower. And I couldn't be in my house more than a few days at a time. So I started doing shifts. So I would be home for a couple of days, and then I'd go, maybe get a hotel room if I could afford it. And then next time, maybe I'd go to my partner's house, and then maybe a family's house. And it's been a lot of bouncing around. But ultimately, while I was in my home, I ended up getting a very severe respiratory infection. And to this day, I'm left with congestion, lingering coughs, fatigue. And because I have these pre-existing conditions, they've gotten a lot worse. So my joints have been really swollen from my arthritis. There have been, it's been really years since I've had these issues, and now they're coming back to light. So a condition I have called Raynaud's, it impacts usually your hands. So if I'm exposed to extreme temperatures, my hands would turn purple. And immediately after the open burn, I noticed my feet were turning purple, and I've never had that happen before. So that was a, new symptom of my pre-existing condition for me. And then the thing that I believe is the most serious is I have endometriosis, and I've had many, many surgeries for this. It took me years to get on the right, medication and the right lifestyle changes. And since the derailment, have actually started menstruating for the first time in 5 years. So to treat my endometriosis, they had to stop menstruation completely. And all of that work that, has kept me healthy now for many, many years, that's kind of been thrown out the window.
Are you still living in your home, and do you think it will ever be safe?
So I am in my home right now. I want to move out. My family got a rental home, but with my house, the way it smells, we can't bring anything that we own in there. We actually did, and we unzipped the suitcase, and the smell came with us. It traveled with us. So now we have a home with a mattress and some donated items, but there's nothing else in it, because not only is our home affected, everything in it is. Any soft surface item, wood, metal. Ironically, we're told plastic is possibly one of the only safe things that would not have been affected, which of course is pretty wild, considering plastic is a big reason we're having this issue here. Everything that we do right now, as a Pennsylvanian, at least outside of the 1 mile radius, is we have to pay for that. So I've worked over 70 hours every week since the open burn, trying to save up money. And, I'm able to get my family a rental, but am I able to replace everything? Not currently. It seems pretty impossible. So I honestly don't know if my home will ever be safe again. It's something that I know really breaks my grandma's heart. It obviously breaks my heart. But what I do know is that it's affecting my health. And with my history, I just can't risk that.
Others.
Rachel, I think you're freezing up, so we'll turn your video off. Hopefully that'll make the audio a little smoother. So Rachel, can you ask that question again?
Yeah, sorry about that. Hopefully you can hear me. How are your other community members doing? Are your concerns and experiences shared by your neighbors?
Yeah, absolutely. So it's been a really hard time for everyone. I know a lot of people that have developed symptoms that had never had symptoms before. I know a lot of people with pre-existing conditions that are getting worse. I would say the most common symptoms right now would be migraines, congestion, rashes, itchy eyes, diarrhea, and a lot of people had a respiratory illness, whether it was, bronchitis or some type of infection. And there are extreme cases at this point. I've heard of community members with new symptoms such as seizures, and now we're seeing a lot of swollen lymph nodes. So, there's people that have been affected. There's quite a few of them. And then there's people that, just like COVID, there's people that get sick and there's people that haven't. And that's caused a little bit of a divide. But now that we're understanding how chemicals affect women and children, much more than the male population, I think the community is starting to understand a little bit more. And, why some people are sick and some aren't. And that's thanks to a lot of the wonderful work that Unity Council has been doing with independent scientists, researchers, and healthcare workers.
Mm-hmm. Moms Clean Air Force has joined with other groups and called on elected officials and the EPA to ban vinyl chloride because of how damaging it can be. Are there other things you would urge lawmakers to do to support those impacted by the train derailment?
Yeah, I was so happy to see that Moms Clean Air Force is trying to, get vinyl chloride banned. And, my home tested positive for vinyl chloride through independent testing. So I know how dangerous it is. I know the health effects. I know the financial effects, the spiritual and mental burden that these chemicals are causing. I've seen that. So as a part of Unity Council, myself and a group of residents from both PA and Ohio, we really have been advocating for Ohio Governor Mike DeWine to ask for federal support. So we went to Columbus, happy to see that he did that. But in his letter to President Biden, he said there were no current unmet needs. And that is absolutely not the truth. So Unity Council went to DC. I guess that was a week ago at this time. Time is flying. And we just talked to every senator and congressperson and government official we could find. We had a lot of meetings. And we're just urging them that you need to push President Biden to sign this major disaster declaration, because there are still residents in PA and Ohio that need help, and we need it right now. And then, of course, in addition to that, we're going to continue to advocate for railroad safety. These things seem so common sense. And I think this has really opened a lot of people's eyes to see a lot of flaws in our system. And now, as affected community members, we're going to fight to make sure that this doesn't happen to another community, because it will if we don't make changes.
Mm-hmm. Thank you so much, Hilary. Thank you for all of the work you're doing. Thank you for continuing to share your story. It's so important, all of this work that you're doing, and we can't thank you enough.
Thank you for having me.
I second that. Thank you for the powerful testimony. At this time, I'm going to turn it back to Vanessa to talk about the petrochemical industry and its impact.
All right. So as we heard from Hilary, there have been a lot of difficulties that have happened for East Palestine and for the areas in Pennsylvania that were impacted as well by the train derailment that occurred there. But really the conversation also needs to acknowledge and recognize that vinyl chloride is a petrochemical, and that's a part of a much bigger story going on in Pennsylvania. And that bigger story includes the Shell plastic plant that's in Monaca, Pennsylvania. For anybody that hasn't seen a picture of it or really thought about the sheer size of the plant, it takes up around 384 acres. And what we found over the start of production is that it has had numerous notices of violation. It's been fined $10 million. It's been forced to shut down its plant because of the difficulties they were having. And those all impact the local community. So, and to be clear, the plant just came online in November of 2022, and it's August of 2023. So it hasn't even been going for a year. And some of those incidents of violations included serious air pollution and even a benzene release. And what we know about benzene is that it is another cancer-causing agent. And I think what you can see as we start to talk about this bigger picture is an evolving story of serious public health concerns for the kinds of chemicals that the petrochemical industry uses. And what we also know is that Shell's plastic plant has done a ton of flaring, and flaring is an attempt to burn off chemicals. And unfortunately, a lot of that flaring has been very unsuccessful and not sufficiently accomplished what it's meant to do. This is an example of one event where a flare, clearly with the black smoke coming from it, did not burn off all of the chemicals that it was attempting to burn. This is a graph from EPA of the air quality in the Beaver area and near the Monaca plant. What we're looking at right here is PM 2.5, which is a really significant air pollutant. And you can see that the numbers on April 12th spiked into the very serious red area on the monitors surrounding the plant. But there are a lot of other kinds of air pollution that this plant contributes to the air, including carbon dioxide, which we know is a major greenhouse gas, nitrous oxides, hazardous air pollutants, volatile organic compounds, as well as not at this plant, but clearly vinyl chloride is a part of the petrochemical set of chemicals that can occur. So, as we were saying, the conversation around petrochemicals is a large conversation, and it's really important in Southwest Pennsylvania that we make sure that we're having this conversation because of what happened in East Palestine, but also because of the greater impacts to our region. When we talk about plastic plants like the Shell ethane cracker plant, there are a lot of human health concerns that come along with the pollution that occurs there. And some of those can be things like cancer, neurological problems, cardiovascular disease, respiratory issues, birth defects, and asthma attacks. And what we really also have to think about is this conversation of cumulative impacts. You know, we can't pretend like the plastic plant is the only source of pollution in all of Southwest Pennsylvania. We know that there are many other sources of pollution, and that the oil and gas industry and fracked well pads and all of the infrastructure that goes with it, all of this has to be looked at together to understand the true impact to local residents who live and breathe near these sites. And the other thing that is really important to center in the conversation, and that I think we all want to make sure to highlight, is that those impacts are felt most by low wealth communities and communities of color, those most vulnerable because of all of the social and social pressures, as well as the placement of these kinds of polluting industries near their communities. And so what do we do with all of that? You know, what is sort of our next steps I think you heard earlier, Moms has been working and with many other organizations to tell the EPA to ban vinyl chloride. You can sign on to our petition. It's a great way to sort of do something about this really important topic. Support the emergency declaration that the East Palestine and Unity Council have been working to have put in place. Learn more about ethane cracker plants and the oil and gas industry so you can really understand what is going on and what these impacts are to local communities. Partner with community organizations like the ones on this webinar, Health First, and all of the amazing organizations like Environmental Health Project and Center for Coalfield Justice and Evangelical Environmental Network, all doing work to try to make sure that communities and elected officials are educated around what is happening. Really centering the most vulnerable and impacted, making sure that stories like Hilary's are heard and understood is important, and doing a lot of advocacy around those things. And so with that, I will finish up.
Thanks again, Vanessa. Now, Carolyn Heckman will speak about the health impacts related to coal. Carolyn is the Pennsylvania Policy and Outreach Coordinator at the Evangelical Environmental Network. Carolyn received her Bachelor of Science in Energy and Sustainability Policy and Geography minor from the Pennsylvania State University. Carolyn interned for the Pennsylvania Department of Environmental Protection and ICLEI as part of their Localized Climate Action Plan, LCAP program, drafting a climate action plan for the Millersville Borough, PA. Carolyn has previously worked in conservation for the Pennsylvania Council of Trout Unlimited as their community engagement coordinator. While originally from Northeast Philadelphia, Carolyn now resides in central Pennsylvania with her husband and son.
Thank you, Nina. Hi, my name is Carolyn Heckman. As Nina mentioned, I'm the Pennsylvania Policy and Outreach Coordinator for the Evangelical Environmental Network. Today, I wanted to speak to you about coal, PM 2.5, and their impact on children's health, specifically in Western Pennsylvania. Coal is a combustible black or brownish black sedimentary rock with a high amount of carbon and hydrocarbons. Coal is classified as a non-renewable energy source because it takes millions of years to form. Coal contains the energy stored by plants and lived hundreds of millions of years ago in swampy forest. Layers of dirt and rock covered the plants over millions of years. The resulting pressure and heat turned the plants into a substance we call coal. Several principal emissions result from coal combustion: sulfur dioxide, nitrogen oxides, particulates, carbon dioxide, mercury and other heavy metals, and lastly, fly ash and bottom ash. While all these emissions are costly for children's health, today I want to focus primarily on particulates such as PM 2.5. PM 2.5 is a very fine soot, 2.5 micron in diameter, and largely generated by the combustion of coal, diesel, gasoline, biofuels, and related high temperature processes. It contains highly complex mixtures of particles, including soot, organics, nitrates, sulfates, metals, and related chemicals that can penetrate deeply into the lungs and brain. Due to the recent Canadian wildfires, PM 2.5 has become a popular topic, as an apocalyptic orange haze settled over much of the eastern United States earlier this summer, with that haze making return visits over the last few weeks. Currently, the EPA has stated average standards with levels of 12 micrograms per cubic meter and 15 micrograms per cubic meter are considered safe, while 24-hour standards levels max out at 35 micrograms per cubic meter. Once past 35 micrograms per cubic meter, levels are considered unhealthy for everyone, but especially the vulnerable. On June 29, 2023, parts of Pennsylvania saw these 24-hour exposure levels of PM 2.5 soar past 80 micrograms per cubic meter, making the air dangerous for everyone and everything to breathe. The American Lung Association State of Air 2023 report finds that despite some nationwide progress on cleaning up air pollution, more than 1 in 3 Americans, over 120 million people, are living in places with unhealthy levels of ozone or particle pollution. The burden of living with unhealthy air is not shared equally. People of color are over 3 times more likely to be breathing the most polluted air than white people. The consequences of breathing in soot can be quite severe and life-threatening, particularly to those more vulnerable. Like those with cardiovascular disease and/or respiratory illnesses, communities living in areas with poor air quality, pregnant women and their babies, children, and the elderly. While we primarily focus on children's health today, I wanted to touch on the impacts this pollution has on the elderly as well. PM2.5, ozone, and other pollutants can cause dementia, cardiopulmonary diseases, and shorter lifespan. A new meta-analysis from the Harvard T.H. Chan School of Public Health has found consistent evidence of an association between PM2.5 and dementia, even when annual exposure was less than the current EPA annual standard of 12 micrograms per cubic meter. Researchers found a 17% increase in risk for developing dementia every 2 micrograms per cubic meter increase in average annual exposure to PM2.5. Pregnant women and their babies are also at risk due to PM2.5. The leading cause of preterm birth is in uterine inflammation, which the leading cause of in uterine inflammation is PM2.5. 1 in 9 pregnancies in the United States result in preterm birth. This statistic is even more alarming for African American communities at 1 in 5 pregnancies. 35% of preterm births result in death, costing about $4.33 billion per year. Low birth weight and preterm birth are leading risk factors for death in the first term of life, contributing to an estimated 1.8 million deaths worldwide. PM2.5 continues to threaten children after they are born as well. According to the National Survey of Children's Health, greater than 37% of American children suffer from asthma, autism, ADHD, or severe allergies. PM2.5, ozone, and other pollutants can cause all of this. The American Lung Association ranks the Pittsburgh metro area the 14th worst area for year-round particle pollution and 20th for short-term particle pollution. Let's break down some facts regarding PM2.5 in children's health. Black and Hispanic children are about 5 times more likely to be hospitalized for asthma-related causes, more so than white children. According to the American Lung Association, research shows children exposed to high concentrations of particulate matter pollution near industrial point source pollution in parts of Pittsburgh increase their odds of developing asthma by 58% compared to children living in areas with lower PM2.5 levels. Autism and ADHD are becoming more prevalent in our children, and our pollution like PM2.5 is playing its part. According to the CDC, using 2020 data, autism prevalence has increased in 1 in 36 children. Exposure to PM2.5 has been linked significantly to the increased risk of autism in children, particularly if exposure occurs during the 3rd trimester of pregnancy or during early childhood, according to a meta-analysis from the Harvard T.H. Chan School of Public Health. The new study found that the risk of autism increased by 64% with exposure to 10 micrograms per cubic meter of PM2.5 during early childhood and 31% during prenatal periods. During the prenatal period, the greatest risk was found during the 3rd trimester. The results also suggested that PM2.5 exposure could affect vulnerable populations even at low levels below current regulations. Furthermore, children living in areas with higher pollution due to PM2.5 particles and very low levels of green space might have up to a 62% increased risk of developing ADHD. Allergy sufferers living in cities with high levels of PM2.5 were found to be the most affected when it came to severe symptoms, where an increase of 5 micrograms of fine particulate matter concentration was associated with a 17% higher chance of severe rhinitis symptoms. While these devastating impacts to our children, and with all these devastating impacts on our children and future generations, we at EEN believe it is important to remember that defending children's health is a biblical command. Defend the weak and the fatherless, uphold the cause of the poor and the oppressed, rescue the weak and the needy. We are not hopeless or helpless. Together as a collective, as well as individually, we can spread awareness and fight for stricter coal and PM2.5 safeguards within our communities for our neighbors and our children. After all, creation care is a matter of life and hope. Thank you.
Thank you, Carolyn. Last but not least, Alison Steele will talk to us about the health impacts related to methane. Alison is the Executive Director of the Environmental Health Project. She earned her undergraduate degree in physics and her MBA in Sustainable Business Practices. Prior to starting at EHP, she led a grassroots community engagement program focused on advancing home health and energy efficiency in low-income Pittsburgh neighborhoods. She joined EHP at the beginning of 2020, and since then, she and her team have been taking advantage of our increasingly virtual world to extend their reach as they work to defend public health in the face of shale gas development.
Thanks so much, Nina. Thank you, everybody. I'll try to go through this as quickly as possible since I know we're running short on time. I'm really happy to be here talking about how emissions from the shale gas industry, aka natural gas, aka fossil gas, aka methane, are harmful to human health, particularly to children. And I'm just going to take a quick second to talk a little bit about the Environmental Health Project, our background, how we got here, and why we do what we do. At EHP, we believe that everyone should have the opportunity to live healthy lives no matter where they live. And that's why we advocate for strong public health policy in the face of oil and gas development. And that includes ensuring stronger health protective measures and accountability around existing infrastructure, making sure decision makers are getting complete and accurate information before they commit to build new facilities, and then making sure our broader community of individuals and organizations has the tools and information necessary to protect those who are most vulnerable and most impacted by continued oil and gas development. EHP was born in Southwest Pennsylvania more than 10 years ago as a response to a growing number of families who were scared that gas extraction activities in their neighborhoods might be making them sick. We have always been a nonpartisan organization driven by data and research to develop recommendations that can help protect people in their homes. And over that time, EHP has combined a decade of direct community science experience with a thorough review and consolidation of the latest research on the health impacts of certain chemical substances or certain types of facilities in the shale gas life cycle. And that information together has given us a comprehensive perspective that we use to advocate for stronger public health protections around related infrastructure. And when I talk about infrastructure, we're talking the full life cycle. We're not just looking at the well pads and the extraction phase, though those tend to get the bulk of the attention. But the entire life cycle includes gas extraction at the wellheads through to transportation through pipelines and compressor stations, all the way to how hazardous solid and liquid waste is disposed of and how hazardous materials are transported by barge, road, or rail. And there are also end uses to consider, whether that's gas being used to create electricity or blue hydrogen or plastics, and whether that gas is coming directly into your home to cook your food. There are health risks at every stage of this life cycle. It's important to note, you may have heard arguments in favor of methane saying that methane burns clean, except that a massive amount of methane escapes into the air unburned through leaks at every stage of this life cycle. And while wellheads are not the only risk, it's been estimated that half of all methane emissions in the US come from wells that are small enough to escape regular inspections, not to mention an estimated 200,000 plus tally of orphan and abandoned wells across the state of Pennsylvania that are continually leaking gas. And unburned methane contributes to a broader public health crisis in a number of ways, not just by worsening the effects of climate change, which carry with them a host of concerns, including increased frequency and severity of storms, fires, floods, heat waves, and vector-borne diseases, but it can also seriously impact the health of residents in more localized circumstances, as it contributes to the deterioration of regional air quality by helping to form secondary pollutants like carbon dioxide and ground level ozone or smog. But in addition to those impacts of methane, when we're talking about methane leaks, when we're talking about shale gas, fossil gas, it's important to remember that that gas is largely methane, but not exclusively methane. It brings with it other harmful substances as well, including volatile organic compounds like BTEX chemicals, benzene, toluene, ethylbenzene, and xylene, which are all federally considered to be hazardous air pollutants, and radioactive materials such as radon. So given the risk of exposure to these types of substances, there are now dozens of peer-reviewed epidemiological studies that show a correlation between shale gas activity and health harms, including heart disease and heart attacks, increased risks of asthma and other respiratory illnesses, neurological issues, mental health issues, skin problems, certain types of cancers. And on top of all of this mountain of peer-reviewed literature, there are hundreds of investigative reports that corroborate what we've seen in these studies by demonstrating similar health impacts, pointing to elevated levels of toxic chemicals in the blood, urine, hair, and nails of many people, including children, living close to shale gas development. And when we're talking about a lot of people being exposed to this, we have approximately 1.5 million Pennsylvanians living within half a mile of an oil and gas well. So these are not small numbers that we're talking about. And we also need to recognize that there are arguments saying that gas extraction is good for the economy, which you may have heard that said over the years. But when we're talking about this massive number of people at risk, we can confidently say, and thanks to several economic studies as well, that this is not the case. When we start talking about days of missed work or school or emergency room visits or hospitalizations or medications and specialized care for these types of conditions that increase in frequency the nearer people are to different types of infrastructure like well pads, pipelines, compressor stations, cracker plants, and more. One recent study out of Boston University looked just at 2016 data and pointed to an additional $77 billion in health damages across the United States just from oil and gas pollution, with thousands of early deaths and over 600 of those early deaths and over 36,000 cases of asthma exacerbations happened in Pennsylvania that year. And unfortunately, despite all of what we have learned to date about these health impacts and how people are harmed, we're still looking at the possibility of more extraction activities, not less, in the future. Between the cracker plant in Beaver County, the proposed blue hydrogen hubs that could be built, the proposed LNG terminal in Chester outside of Philadelphia, committing to projects such as these locks us in for more gas extraction for decades and puts more people, particularly children, in harm's way. And we've talked a little bit about health impacts on children previously, but I just want to say briefly that there have been many studies done to date to examine birth outcomes near shale gas infrastructure. And from that literature, we know that there are a number of health impacts associated with fetuses developing in the womb, and we see impacts related to the number of babies born with congenital heart disease, possible connections to neural tube defects. We see instances of increased preterm birth and low birth weight. Low birth weight itself can lead to serious future consequences in growth and development, including diabetes, heart disease, high blood pressure, intellectual and developmental disabilities, obesity, and early death. We know that for kids themselves, 1 out of every 8 kids in Pennsylvania is going to suffer from lifetime asthma, which is one of the more obvious symptoms of exposure to pollution. But as we've seen, there are other conditions that can develop with chronic exposure. And kids are especially vulnerable for several reasons. They accumulate toxins in their bodies more than adults do because they're still growing. Their bodies don't clear those toxins as quickly. And some of those substances are carcinogens and endocrine disruptors, which interfere with how their bodies actually develop. They also have higher breathing rates, breathe in more air per pound of body weight than we adults do. They tend to spend more time outside than we do, tend to engage in more vigorous activity than we do. So they're effectively being exposed to more while also at a much more critical time. So the question remains, what can be done to protect people, particularly those who are among the most vulnerable, children, the elderly, people who are pregnant? And the answer is reducing exposure to methane and the other substances that come with it, volatile organic compounds, fine particulate matter, radioactive elements. Reducing that exposure in the first place will lower the risk of a wide range of serious health impacts. And there are a couple ways to do that. First is making sure that related to existing infrastructure, and again, this is not just the well pads, this is the entire life cycle. We need stronger protective measures that compel industry to further reduce their emissions. That can happen through stronger inspections and penalty enforcement protocols, including requiring facilities to use the best available technologies to capture methane and stop leaks, but also ending routine behaviors like flaring that can also exacerbate problems nearby, and requiring continuous monitoring and making that data available to nearby communities and third-party evaluators. But also, in addition to existing infrastructure, having stricter permitting processes for new infrastructure that includes looking at aggregate emissions, taking into account all of the sources of pollution within a given airshed whenever there's an opportunity to permit a new facility and understand the added impact of that on what's already happening. And certainly increasing setback distances between facilities and occupied buildings. We know that state agencies that are tasked with protecting public health and regulating the industry are frequently underfunded and undersupported. So making sure that they've got a clear directive to do their jobs, but also sufficient funding to do that. And that bandwidth and support is determined by the legislature. And then finally, making sure that communities, frontline communities, have a say in what happens in their neighborhoods. There has to be meaningful engagement that includes allowing residents to have a say in what happens, including if it's ultimately, no, we don't want this here. That is such a huge component that has been largely left out of this process to date. So I will wrap up by saying that the path that got us to where we are today has involved downplaying a lot of existing public health research, as well as information from families living on the front lines of industrial activity regarding their lived experience. But we do have the opportunity to change by creating stronger, more health protective approaches to oversee shale gas activities in Pennsylvania. And I hope that as we work towards that goal, you will consider EHP a resource. Thank you very much.
Thanks, Alison. And a reminder for folks, if you have questions, you can type your question in the Q&A dialogue box. Maybe we can have our speakers jump back on video if you're able to do it. And thanks, folks, again, for bearing with us with the technical difficulties and jumping back on. So this first question is really for Hilary. And that is for people who do not live in the immediate area of the train derailment. Can you talk a little bit more about the situation in the community and what hardships your neighbors are dealing with? And I will editorialize. One way to think about this question might be, how different has this summer been than last summer in the community?
Yeah, so I think, there's a big difference. People aren't gardening. People are limiting the time that their kids are going outside to play. As a dog owner, I know I'm limiting, my dog's time outside. And what we're really seeing is people are only getting assistance within this 1 mile radius. There are so many people still displaced, living in hotel rooms with their families. And yeah, I would say that this summer, not only are we behaving differently, everyone is, physically feeling differently and absolutely thinking differently. So it's definitely had a continued impact on this area.
All right, so I'm going to editorialize again and ask a follow-up if I can, Hilary. Do you feel like people have hope that that's going to be different next summer, for example?
Well, I think that there is a lot of people who at this point just really aren't trusting the information that's out there. So what we're seeing is there are a lot of people leaving the area that, they're talking about not just temporarily relocating, they're talking about moving out of state. They're talking about getting far away from here because they've definitely lost hope, and they've lost faith, and they've lost trust. And there are people that, have hope. A lot of business owners in the community seem to, really be hoping and wishing that things are going to turn around. But what I've seen is a lot of the residents, they want things to get better, but they don't necessarily think that's what will happen.
Thanks, Hilary. We have a lot of amazing organizations represented on this call. So not all at once with jumping in on this question, but it's a pretty simple one. How can people that are upset about this presentation actually do something? So open floor on that one.
Well, I'm happy to start. I think one of the easiest things is reaching out to the organizations that are represented here. We are all doing a lot of work locally and at the state level and federally to make sure that these stories of frontline impacted community members are being brought to the attention of elected officials and people across the country. And I think just as simple as reaching out to one of us and becoming a more active member of the community, doing all sorts of things. I don't know if Alison, you want to talk about some of the things people can do once they join us and come work with us a little bit. But
yeah, certainly if you are living near infrastructure that's concerning you, EHP has a number of resources on things that you can do to stay safer in your home in the short term, but certainly the longer term view is critical to make sure that we are protecting everybody more effectively and more broadly. So in order to do that, you absolutely need to be reaching out to your elected officials. Vote, but also talk to them, call them, write to them, let them know what your concerns are. We're not going to shift the public narrative without people getting involved in talking to their friends and family, writing op-eds, getting involved and letting people know the information that you have heard today, and certainly reaching out to any of our organizations for information and resources, so you have things that you can share with friends, family, local community groups, and your elected officials. That is how we are going to help change the perception that these activities are being done safely, because they're not.
All right, there are no more questions in the Q&A dialogue box. I'm going to filibuster for 1 minute to see if there are any last questions. So maybe this is the last word. So this is a question from me, and we'll maybe give Hilary the last word here. Hilary, I also live in Western PA, not far, but not in that immediate area evacuation zone. It seems as though that there was a ton of media attention, a ton of political attention on your area. I assume you're feeling this already, but it seems like that has waned a bit, and that has to be frustrating. So I wonder if you have legislative staff who are listening, if you have press who might be listening or other folks, what would you say as a person who lives in that community and like you said is feeling the effects, whether that's the local economy or people's health? Well, I think what you might maybe an open floor to voice your frustrations a little bit about all of that attention early on, and then less attention, let's just say, as the health effects and the effects on the local economy certainly don't wane, and in some respects probably are worse and will get worse before they get better. So maybe the last word to you, Hilary.
Thank you. So I will say we still are getting some national media coverage. News Nation has been really, really great to the community. And we have people from Unity Council on News Nation on a weekly basis. So just special shout out to them for continuing to keep this in the news. I will say Pittsburgh media could do a lot better. Ohio's obviously kept their eye on this, but it seems like there's been some nuance lost that, there are Pennsylvanians affected. So, if you're Pittsburgh media or Pittsburgh, legislature, keep your eyes on this. PA people are affected as well. And as there are so many things still that need to be done. This isn't something that just happened 6 months ago. This is something that is ongoing. It's still happening. My home still smells like sweet bleach, and we're not being given the proper resources, whether that's, financial, whether that's testing. So if there's anything that you can do for the community, it's really advocating for a couple of things. Section 1881A, which is a part of the Affordable Care Act, medical care or Medicare for anyone affected by an environmental health crisis or environmental crisis. That's something that people here desperately need for long-term health monitoring. Asking President Biden to sign this major disaster declaration. No matter who you are, you can write to the White House. You can write to every single senator, every congressperson you can find. We need to be pushing Biden to do this, and then just supporting the people here. The people here are still suffering. So whether it's as simple as joining a Facebook group, so Unity Council for the EP train derailment, that's where Unity Council posts all their updates. And if you're interested in the further petrochemical industry information and, especially how it's affecting Beaver County, you also have Beaver County Marcellus Shale Awareness Community, BCMAC, and they're doing a lot of the watchdogging and the fighting the Shell petrochemical plant. So there's opportunities to get involved. There's opportunities to stay engaged. What we really need is, people to continue advocating for us. We're a small community, a small group of communities, so we really need you in this time. So, and if you ever need anything, I promise I am not hard to find. So feel free to reach out.
Well, thank you to all our speakers, but especially thank you to Hilary for being willing to come on and tell her story and speak up. And we really, really appreciate all that you're doing, Hilary. A reminder that we'll send an email follow-up afterwards to everybody with materials, including we will, thank you for your patience again, we will put part 1 and part 2 of today's webinar together as one link and send that over. So thank you everybody again for your patience with the technical difficulties. Thanks to all our speakers, and everybody have a great rest of your day.
Thank you.